Hello, greetings, namaste. This video is about my third course that I conduct each year in India called Herbology and Dietary Treatments of Ayurveda. Now, this course builds, of course, on the first two courses. The first course, understanding the fundamentals of Ayurveda. The second course, having diagnostic skills to understand, the actual imbalances from the Ayurvedic point of view. So you should really have these, excellent knowledge of the fundamentals of Ayurveda and of the tri-doshic system, the subdoshas, the datsus, the agni, the ojas, and amas, and other essential aspects of anatomy before doing this course. And of course, you have to have good diagnostic skills by observation, by questioning and touching, which includes pulse reading. So all this should be strong. If you're not strong in these areas, then you should consider doing at least the diagnostic course if you're familiar with Ayurveda, or just going right back to the basics, doing the fundamentals and then the diagnostic course, and then putting this course off, to the next year, so you have a strong foundation. So all the people attending this course have generally already completed the first two courses. We use two books in this course, Ayurvedic Herbology, East and West, a practical guide to Ayurvedic medicine. And from this book, we study 50 herbs, which you really need to study in advance, and then we're going to discuss and taste and try and these herbs in the course, and talk about how they can be treating different systems and in the body, in datsus, and also how they can make little mini formulas using these 50 herbs. And the second book we use is Ayurvedic Medicine for Westerners, Clinical Protocols and Treatments of Ayurveda, Volume 3 of Atreya Smith's book. And we use that book mostly for the ahara chikitsa, the treatment of food. So this course requires 150 hours of pre-course study. This is an 8-day course in Kerala. I do 30 hours of treatment, or 30 hours of teaching there, and you have 20 hours of self-study during these 8 days. And the main objective of this course is to understand the attributes, or we call gunas, and actions, which are the karma and the taste, rasa, of all vegetables, fruits, grains, nuts, and other food items. So this takes a few days, because ultimately you want to be able to form therapeutic diets to address specific health conditions. This is called ahara chikitsa, or using food as medicine. And as I mentioned, we'll also review and study 50 herbs and how these herbs can be combined to treat doshic imbalances and the subdoshas. And we'll be a role playing to practice prescribing dietary and herbal formulas based on the 50 that we know in a role playing environment. So I have like little case studies, like this person has, is a pitta prakriti, pitta vikriti with high blood pressure, and a few more little bits of information. And then the person who's the patient, so to speak, they then answer questions based on the knowledge that I give them on paper, and then the student who's practicing being a practitioner then treats them by prescribing a specific diet, maybe a pitta pacifying diet, and talks about the different fruits, vegetables, grains that would be suitable for that person, and what fruits, vegetables, and grains and oils and spices they should avoid, and then gives them some herbs to take before a meal, after meal, before bed, based on the herbs that we talk. And even making simple little formulas, like 3-4 herbs together, to make a little formula that they can take, before meals, after meals, or, between meals. There's different times to take these herbs. So first we start by going over these 50 herbs, and we learn about their attributes, taste, potency, and their post-digestive effect. And actually, we don't learn all 50 in one day. What we do is try to do about 5, 6 each day and spread it over the 8-day course. So we do each day, we do a little 5 or 6 herbs, maybe in the morning, another 5 or 6 herbs in the afternoon, and we do that each day to cover 50 herbs. And then we spend quite a bit of time talking about using food as medicine, as ahara chikitsa. This is a big part of this course. We learn how to balance vata using food and eating habits, pitta using food and eating habits, kapha using food and eating habits, and of course learning how to treat the combinations like kapha vata, pitta vata, kapha pitta, etc. And then we learn about the basic, pharmacology of Ayurvedic herbs. This is called drava guna, the actions of substances, or herbs in this case. And we learn about the 20 gunas, which we should have learned about in the first course, but now we're talking about them in terms of food and in terms of the herbs. So we learn about the rasa, the taste, the vira, the vipak, and the prabhava, and the actions of these herbal substances, the karma. So we're doing that for all these 50 herbs, and we're learning how to balance, prana, udana vayu, apana vayu, samana vayu, vana vayu, all the subdoshas of vata, all the subdoshas of pitta, all the subdoshas of kapha, manda agni, trikshna agni, vishama agni, and sama agni, learning how to treat with diet and herbs, and of course how to treat prana, tejas, and ojas as well, increasing these or balancing these with herbs. And we're learning herbal and dietary treatments for 14 systems in the body: the respiratory system, pranavayu sotra, the digestive system, anavayu sotra, the water digestive system of the body, Ambu vayu sotra, and how to treat conditions of the lymph, or rasa vayu sotra, and the datsu, conditions of the blood and liver and spleen system, we should say, rakta vayu sotra, treating conditions of the muscles, mamsavayu system, like inflammatory muscle conditions, conditions of the fat tissue, medavayu sotra, and the datsu, excess fat, under absence of fat, conditions of the joints and bones. This is ashtivayu sotra and datsu. Conditions of the nervous system, mejavayu sotra and the datsu, and conditions of the reproductive system, shukra vayu sotra, and of the 3 eliminating systems, the colon, Pusha Vaya Sotra, the sweat glands, Sveta Vaya Sotra, and a urinary system, Mutra Vaya Sotra. So it's a big course. It's taking 8 days of intensive training. This course includes 7 nights, certification for 200 hours of study. Some of the meals includes a private room with attached bath and a nice hotel in Kerala, in Fort Kochi, room service, evening dinner on the first day, and breakfast on the last day. There'll be guest speakers every day. You'll have access to panchakarma treatments at reduced rates, and there's plenty of local entertainment and shopping nearby. So again, this is a very small group, and if these are either people who have already studied Ayurveda and diagnostic skills in the past or in practice, or mostly it's the students that I already have that have completed the first 2 other courses. So it's a beginning of treatment, and the course focuses mostly on food and 50 herbs and understanding the Strava Guna, the principles of using herbs and food for treatment. And then the 4th course, we talk about making formulas and traditional Ayurvedic formulas, and we no longer are focusing on using food as medicine. So this course very much is focused on using food and simple herbal formulas and these 50 herbs as a form of treatment. So you have a basic form of treatment. And when you finish this course, you will have 500 hours of training. If you did the first course, 150 hours. Second course, diagnostic skills, 150 hours. This course, 200 hours. That's 500 hours, and that's enough. I will issue a certificate for Ayurvedic lifestyle consultant for 500 hours, and then you can take this certificate with my recommendation letter and apply for registration as an Ayurvedic lifestyle consultant or Ayurvedic health consultant in respective Ayurvedic associations, and then you can register yourself as an Ayurvedic lifestyle consultant, Ayurvedic health consultant. There's different titles that different associations have, but you would require to be able to prove that you've done 500 hours minimum of study. So these first 3 courses do fulfill these needs of having 500 hours of study. And you'll love Fort Kochi. It's a beautiful place right on the beach. It's very warm in the December. We're conducting this course in the December period, and the weather's very nice. The beaches aren't very far away. And we're working with Dr. Ambu, who is like, I think, 3rd or 4th generation Ayurvedic doctor, and he's working with a group of other Ayurvedic doctors. They call their group Kerala Ayurveda Vaidyasala. Vaidya means traditional Ayurvedic doctor. Sala means like group, so there's a group of them together, and each of these doctors will be our different guest speakers. This is really a great opportunity to work with these doctors. And once again, I'll give you the certificate as a registered Ayurvedic professional or Ayurvedic continuing education provider or PACE provider, and this has been awarded to me by the Ayurvedic Association of Ayurvedic Professionals of North America, APNA. And once you have this from me, then you can apply with them to be a registered Ayurvedic lifestyle consultant, or you can also register with other Ayurvedic associations or use just the credits for this course, this particular one, 200 hours, to obtain continuing education credits with any other registration association that you're involved with. So I'm only teaching and herbs and formulas that are available here, so you have a model to work with. And of course, I'm sharing my personal experience in what I do in treating these particular conditions, even though we're working from books, and so we have a lot of resource of the books and what they're advocating, but even that may not be clear to the student, but I can express what I'm doing, what herbs I'm using, and how I explain the dietary treatment to my patients, so then in a sense you can learn from my knowledge. And this helps a lot, because if you just read a lot of books with a lot of teachers, you may not be clear on how to treat certain imbalances and certain systems in the body. So I'm teaching this to give you a model to practice in the Western world based on my own experience and my own success, which will give you somewhere to start, which will allow you to go and practice early. And then from there, you can expand your knowledge and expand your different forms of treatment and different approaches to the same imbalance. Okay, I hope you can join me in this course, and I look forward to it every year. I love Kerala. I love Fort Kochi, and it's just a great pleasure to work with such Ayurvedic doctors like Dr. Ambu and his associates, and it's very a valuable course. And because I really want to help people, I really feel that we need more Ayurvedic practitioners who are properly trained, and I hope I can help train you and help you to improve your skills so you can become a good Ayurvedic practitioner. Thank you very much.
Hi there, my name is Jade. I just finished the diagnosis and pulse reading course in Ayurveda with Khabir here in Rishikesh, India. It's been extremely informative. I've learned so much in an unbelievably short amount of time about how to properly diagnose based on traditional Ayurveda, the tongue, the pulse, the body type, constitution, and imbalances. And I can't say enough how grateful I am to be here, to be learning this extremely valuable information, and I would highly recommend this course to anyone interested. Thank you.
Thank you very much, Jay.
To thank Khabir very much for the training, class 1 and 2. It was very helpful. I had a great time, really learned a lot. It was a really enjoyable trip and learning experience for me. Blessings to you, my friend.
Thank you very much, Sanjay. You're a good student. Thank you.
Hi everyone, my name is Archana Seth and I'm here with Khabir to attend this program, and I feel very fortunate to be here and being his student, and I've learned so much about Ayurveda, and I feel everyone should learn a little bit of Ayurveda so that you can evaluate your condition, your health condition. We go and spend on so much on medicines, but it's better to spend on a course like this. And thank you, Khabir. Thank you so much. I'm so fortunate here, and I'm here for the second course too because I've really had fun here. Thank you so much.
Thank you very much
Thank
for
you.
your feedback. Thank you.